Your next patient could need a thorough assessment of his musculoskeletal system. Which major structures would you examine? How skillfully will you assess them? How accurately will you evaluate your findings? In this program, we'll discuss how to inspect and palpate the musculoskeletal system and assess joint range of motion. Keep in mind that assessment of muscular strength usually is performed during the nervous system examination. This program will provide the information you need to perform a baseline musculoskeletal assessment. You may modify this assessment based on your patient's condition and complaint. To prepare for the assessment, make sure the room is quiet, well lit, and warm. Also have a tape measure at hand. Next, prepare your patient for the exam by having him undress and put on a gown.
Give you a few minutes of privacy, and I'll be back. I'm going to ask you to have a seat here on the table.
Then ask him to sit on the examination table.
What I'm going to do is
Now, before you begin, let's review what you'll be assessing for during the exam.
Down and then standing up.
When inspecting the patient's musculoskeletal system, look for swelling in or around joints, changes in the surrounding tissues, redness of the overlying skin, deformities, and symmetry of impairment. Swelling may be caused by excess synovial fluid in the joint space or the tissues around the joint. It also may be caused by trauma to the area. Tissue changes may include muscle atrophy, skin changes, and subcutaneous nodules, which may result from rheumatoid arthritis or rheumatic fever. Skin redness may suggest inflammation or arthritis. Deformities may be produced by restricted range of motion, misalignment of articulating bones, dislocation, which is a complete loss of contact between two surfaces, or subluxation, which is a partial loss of contact. Symmetrical impairment typically is associated with a disorder, such as rheumatoid arthritis. When palpating the patient's musculoskeletal system, assess for tenderness in or around the joints, swelling, excess joint fluid, or effusions in or around the joints, increased warmth, and crepitus, a palpable or audible crunching or grating sound. Tenderness may be caused by trauma, arthritis, tendinitis, bursitis, or osteomyelitis. Swelling typically suggests an inflammation. For example, palpable bogginess or doughiness of a swollen synovial membrane suggests synovitis. Unusual warmth suggests an inflammation. Crepitus during joint or tendon movement occurs when the joint's articular surfaces are roughened, as in rheumatoid arthritis. When assessing range of motion, which is the maximum possible joint movement, assess for variations from normal. Particularly note any joint instability or decreased or increased mobility. Usually you measure range of motion in degrees of a circle for each type of movement. For example, the cervical spine normally has a forward flexion of 45 degrees. But remember, normal range of motion varies from patient to patient, depending on age and health. A decreased range of motion may result from arthritis, tissue inflammation around the joint, fibrosis in or around the joint, or bony fixation, ankylosis. When you are ready, begin the musculoskeletal assessment. For the patient's comfort and your convenience, you may organize the exam based on the patient's position, as you'll see in this program.
We're going to do an assessment of your head
With
and
the
neck,
patient sitting,
hands and wrists,
you'll assess
and your
his
elbows.
head and neck, hands and wrists, elbows, and shoulders. To assess the patient's head and neck, you'll examine the temporomandibular joint and cervical spine. First, inspect the temporomandibular joint, or TMJ. Then, palpate this joint by placing the tips of your index fingers just in front of the tragus and ask the patient to open his mouth. As he does so, let your fingertips drop into the joint spaces and palpate them. Snapping or clicking normally may occur. Assess the joint's range of motion while the patient's mouth is open. Normal range of motion creates a 3 to 6 centimeter space between the upper and lower teeth. Also assess range of motion as the patient moves his lower jaw from side to side. He should be able to move it 1 to 2 centimeters in each direction.
I'm going to assess the back of your neck now, okay?
Now inspect the cervical spine. Look at the patient's neck for head and shoulder alignment and symmetry of the muscles and skin folds.
I'm going to
Next,
palpate your neck.
palpate the spinous processes with the index and middle fingertips of one hand. Also palpate the surrounding soft tissues and muscles. Now, assess range of motion.
Bring your
First,
chin down to your
test
chest
for
and hold it.
flexion by asking the patient to touch his chin to his chest. Flexion normally is 45 degrees.
Bring your head back as far as
Next,
you can.
ask him to bend his head backward. This tests extension, which normally is up to 55 degrees.
Bring your head
Now,
from side
test
to
for
side,
rotation
left to right.
by having the patient touch his chin to each shoulder. Rotation normally is 70 degrees on each side.
Then bring your ear
Finally,
to your shoulder,
ask him to touch
left to
each
right.
ear to his corresponding shoulder without raising the shoulder. This assesses lateral bending, which normally is 40 degrees on each side. To assess the patient's hands and wrists, you'll examine the distal phalanges, middle phalanges, proximal phalanges, metacarpal bones, carpal bones, radius, distal interphalangeal joints, proximal interphalangeal joints, metacarpophalangeal joints, and radiocarpal or wrist joint. Begin by inspecting the patient's hands and
Inspect
wrists.
your hands.
Then palpate them by first feeling the medial and lateral aspects of the distal interphalangeal joints between your thumb and index finger. Also palpate each proximal interphalangeal joint using the same technique. Now have the
Flex your
patient
wrist.
flex his hand slightly so that you can palpate each metacarpophalangeal joint. Then, with your thumbs, palpate distal to his knuckle and on each side of it. Next, place your thumbs on top of the patient's wrist and your fingers beneath it. Then palpate the wrist joint. If the patient has had bilateral swelling of his wrist, proximal interphalangeal or metacarpophalangeal joints for several weeks, suspect an inflammatory condition such as rheumatoid arthritis. To assess range of motion, ask the patient to
Open your
make a
hands.
fist.
Spread your
Then
fingers.
ask him to open his fist and spread his fingers. He should be able to make a tight fist and spread his fingers smoothly and easily. Next, ask him to flex and then extend his wrist. Normally, flexion is 90 degrees and extension is 70 degrees.
Lift your left hand up with your palm down and move it from side to side.
Now have the patient move his hand medially to assess for radial movement and laterally to assess for ulnar movement. Normally, radial movement is 20 degrees and ulnar movement is 55 degrees. If the patient complains of hand pain and numbness, especially at night, suspect carpal tunnel syndrome. To detect additional signs of this disorder, perform Phelan's test and assess for Tinel's sign. To perform Phelan's test, hold the patient's wrists in acute flexion for 60 seconds. As an alternative, ask him to press the backs of both hands together at right angles for 60 seconds. With either technique, suspect carpal tunnel syndrome if the patient develops numbness and tingling over the palmar surface of his thumb, index and middle fingers, and part of his ring finger. These areas reflect median nerve distribution. To assess for Tinel's sign, percuss lightly over the median nerve pathway in the carpal tunnel. If the patient experiences numbness or tingling in this area, consider it a further sign of carpal tunnel syndrome.
A little bit.
To assess the patient's elbows, you'll examine the humerus, ulna, radius, medial epicondyle, lateral epicondyle, and olecranon process. To inspect the patient's elbow, support his forearm with your opposite hand so that his elbow is flexed to about 70 degrees. Then inspect it. To assess range of motion, ask the patient to bend his elbow and then straighten it. Normally, a patient can flex his elbow up to 160 degrees and extend it 180 degrees. Next, have the patient place his arms at his sides with his elbows flexed. Ask him to turn his palms up to assess supination and then turn his palms down to assess pronation. Normally, supination and pronation are 90 degrees. To assess the patient's shoulders, you'll examine the humerus, clavicle, acromion, scapula, acromioclavicular joint, glenohumeral joint, and sternoclavicular joint. To inspect the patient's shoulders, look at them from the front and then look at his scapulae from the back.
Are you having any pain?
Before you palpate, ask the patient if he has any pain in the shoulders. If he does, have him point to it with one finger. Palpate this area last. Otherwise, palpate the shoulders with your fingertips, moving along the clavicles out toward the humerus. Then palpate over the greater tubercle of the humerus as you abduct the arm at the shoulder. Continue to palpate as you adduct the arm. Then palpate the scapulae.
Bring your arms forward.
To assess shoulder range of motion, ask the patient to raise both arms forward and straight overhead. Expect to see forward flexion of 180 degrees. Next, ask the patient to extend and stretch both arms behind his back. Expect to see hyperextension of 50 degrees.